Endoscopic DCR is more challenging when the nasal cavity is narrow and access to the lacrimal region is impeded. This nasal cavity has a deviation in the upper nasal septum, which obscures the view of much of the middle turbinate. In comparison, this patient's nasal cavity is much wider, and the whole middle turbinate and the maxillary line can be seen. The nasal septum can be deviated medially with a flat instrument. A Freer's retractor can be used to move it a little, whilst opening a Killian speculum, as you see here, can move it quite markedly. However, there is a case report of this manoeuvre causing a cribriform plate fracture and CSF leak, so care must be taken. The nasal septum can also be gently shifted with the heel of whichever instrument is being used, for example the monopolar diathermy shaft during mucosal flap creation. If gentle instrumentation of the nasal septum is inadequate to provide adequate access and prevent repeated abrasion and trauma to the nasal septum and the nasal mucosa outside the area of the incisions, a septoplasty should be undertaken, which will greatly improve access and minimize trauma. Septoplasty surgery is reviewed in detail in another video on this website.